This is part, thank you, Liz. This is part of the Lunch and Learn sessions that we do with shared safety. So it's open to shared safety members and their staff and affiliates. Today we have a really special session. We're really excited because the city started a pilot, which is a mental health walking clinic, which is something that happened for the first time. And the organization that manages that walking mental health clinic, it's Merakey, and we have two of their staff members today here who are gonna talk about the clinic and the services that they offer there. We have Valen Brosi, who is the director of the mental health clinic, and we have Daniel Orsino, who is the community liaison for the mental health walking clinic. Thank you, Valen and Daniel, for being here. Just take it over, do your presentation, and then we have time for questions. Thank you.
Fantastic. Yeah, so I'm going to share the PowerPoint. If you give me a second. And then we'll hand it over to Daniel to get us started.
All right.
Daniel?
Yep. Do I just click and it'll switch over to the next slide, or?
I have control of the slides.
Oh, okay.
Switch over. So go ahead.
All right. Well, I'm Daniel Orsino. I am the community liaison for the Merakey Mental Health Walk-In Clinic. This is Philadelphia's first mental health urgent care for adults. This program was a long time coming, and it was very needed, I must say. So our program is designed to bridge the gap that was there was a huge gap in service between services between urgent care services and crisis services. We ourselves are not a crisis service, I'm going to say, but we're here to filter people out of the crisis service that don't need to be in it. So we're here to conduct on-the-spot kind of triage and kind of, again, filter people who don't necessarily need to go to crisis. And we've been very effective in doing that. We've prevented a lot of people who don't need to be in the crisis system from going into the crisis system. And that can be a very traumatic thing, being in the crisis system. And, we've been able to successfully link quite a few people, well, not just quite a few, we've been able to successfully link hundreds of people to the mental health resources they desperately need. So if you look here, this is where we first started. This is our, what do we like to call our little humble beginnings here. Merakey, we've only recently taken on the name Merakey. You may have known us by our formal name. We used to be Northwestern Human Services. Merakey opened the first location in Mount Airy neighborhood of Philadelphia over 50 years ago. One of the first community-based providers. This was the Northwest Center on Mount Airy. Merakey has a long history of serving the city of Philadelphia. In 2019, Merakey has grown to offer a full array of services for the community, including outpatient therapy, substance use treatment, case management, residential, mobile teams, school-based IDD, and children, youth, family services. If you look down in the corner, that's what our original building looks like today. It's now Merakey Health, and we're on the way to become a at a FQIC. I never get that abbreviation right. Am I saying that right, Alan?
It's an FQHC, yeah. So we're
FQHC.
in the process of we provide primary care out of this unit now. We also have outpatient services in our CCBHC located in this facility, as well as our case management services. But we are really proud that we are able to pull the Merakey Total Health, the first FQHC, as part of the Merakey's system of services.
Yes, and the building's very big. It's very, very big, and it's very modernized. We just had it recently renovated. So, the Merakey Mental Health Walking Clinic, Merakey is the provider selected by the city of Philadelphia to pilot Philadelphia's first urgent care exclusively for behavioral health support. I want to emphasize, when people hear mental health walking clinic, mental health urgent care, we only provide mental health services. We don't provide medical, we don't provide ongoing care, we just provide same-day supports, and then we provide linkages. We provide accessible, rapid, short-term walk-in services that are not a mental health emergency crisis center. So if someone is seeking crisis services, we are not probably an appropriate linkage for them. We're not. We suggest if someone is in immediate crisis, they go to the crisis center. That's a more appropriate linkage. The goal is to serve individuals in the community when they need care to reduce reliance on crisis and acute levels of care, including hospitals. Um, we serve adults ages 18 and over, with or without insurance, and that is a really important component of our program. We wanted this program to be accessible as possible. So right now, at least until July, when we re-examine our funding, we are completely insurance neutral, meaning we accept insurance from anywhere. We accept Medicaids from all states, all counties. We accept all insurance plans, or we accept no insurance plans. Right now, we're not billing insurance. We are just using it to know where to connect appropriate linkages. We do not charge for our services. That is another important component. Um, we are just looking again when we ask for insurance or anything that just to know where an appropriate linkage, where to send the person for their next level of services. That's something they're seeking. Where to send them. This is a model that demonstrates where we are on the continuum of care. This is more just for a visualization purpose to just kind of show that we are, yes, in between. We were filling that gap between outpatient services and acute intervention services. This is us. This is our facility. This was really cool that I've never done this. I've never been part of a new program where I had the pleasure of opening a brand new facility. So this is really cool. This is our whole team. There's Valen in the middle. There's me. There's our whole team. Mark is on the very end. I know a lot of folks know Mark. Um, Nicole is on the other end. I know a lot of folks know Nicole. Um, Alan, you want to add anything about like our facility or
Well, so I'd like to highlight a couple things actually here. So yes, Mark and Nicole are our executive directors, and we are so grateful to them because they have helped really helm and develop this program so that way we can be what we are. This team in particular, we have a very multidisciplinary team. We have individuals who come from wide ranges of backgrounds, of experiences, educational levels, personal lived experience. And we really think of ourselves as a wrap support for individuals when they come through, because we're only a same-day stabilization support. We're not really designed for ongoing care. So when people walk through the door, we want to make sure we give them what they need in that moment. So we have peer specialists, we have nurses, we have CMAs, we have CRMPs, we have psychiatrists, we have therapists, we have social workers, you name it, we probably have it. And in that way, we're able to really provide the support that individual needs quickly to get them stabilized and re-entered into the community as effectively as possible. The other wonderful thing about our team is that they're all Philadelphians, or the bulk of them are Philadelphians, currently live in Philly, and or are from this particular community in North Philly. So they really understand the consumers that we're interfacing with. They really understand some of the common struggles and the community-based experiences that people have. And we feel that brings a different experience for individuals coming through the door and a different level of understanding because of that. The only other thing for this slide is that we're located at Broad and Allegheny, and we're open. This actually needs to be corrected. We're open 11 to 6 for consumers. But I'll hand it back to you, Daniel. I talked too much. Sorry.
yes, no. I also want to say too, with us being at Broad and Allegheny, we're located on all the major transit lines too. We're located literally probably 20 feet from Broad and Allegheny Station on the Broad Street line. We're located from multiple major bus lines. We're located down the street from North Philadelphia Station, which is connections to Amtrak and also regional rail. So we, again, our goal was to make this program as accessible as possible to individuals, and make it as low barrier. Um, so that was our overall goal here, and with this program. So, these are actual photos of our clinic. Right here you see two photos of our waiting area. These are two different angles of the same room. the waiting area, which we use what's called a living room model, and that's used throughout the entire facility. We use, everything was chosen intentionally, from the colors of the furniture and the paint to the types of furniture and the soft surfaces used. Everything was chosen purposefully to create a light, airy kind of feel. We chose a building with very big windows, to create kind of a big sense of a welcoming space. We didn't want it to feel dark, enclosed, institutional. We wanted a space that felt, that made people feel happy to be there and gave a sense of relief to folks. If you look on the other photo, that's our hallway. We call our hallway of hope. That's all original artwork commissioned from Merakey consumers. Um, so again, we wanted to create a sense of a welcoming space, a very inviting space, something a little different from your traditional mental health facility. Right here is one of my favorite things in our clinic. This is actually still in our lobby. This is a kitchenette. This is not a staff kitchenette. This is a kitchenette that is open to consumers specifically. So you realize our process can take a little while, and sometimes folks might be here for a little while. So this is one of our, the creature comforts that we decided would be, add to somebody's experience. We understand that, when people are comfortable, they're more inclined to open up. So we offer free coffee, free tea, free snacks. We have a microwave if someone brings food and they want to reheat it, they're more than welcome to. All these little creature comforts, contribute to someone's experience and contribute to them feeling comfortable in this place. Um, we just want people to be at ease when they're in our space. Here is an example of one of our exam rooms. Now, generally, all our exam rooms are generally modeled the same. Again, we use what's called the living room model. Our our spaces are designed to put emphasis that this is the consumer space. This is not, you're not walking into someone's office. We don't want it to feel that way. If you notice in the lower corner of the photo on the right-hand side, you see a very small desk. That is the desk that a clinician is usually welcome to use. It's very small. It's only probably about 2.5, 3 feet wide by like 2 feet wide. It's a very small, unintrusive desk. It has wheels. It can be moved around. The majority of space is, open. It's soft surfaces. It's, comfortable furniture. We want to emphasize this is the consumer space. We don't want it to feel like you're walking into someone's stuffy office. It's that a space that belongs to somebody else. When a consumer comes to our space, this is their space for their entirety of their visit with us. We don't shuffle them off to different offices usually. Under rare circumstances, they're going to leave this office if they don't want to. Um, that being said, someone is more than welcome to step outside for a cigarette. If someone wants to go grab food real quick and come back, they're more than welcome to. We are not a closed or locked facility. Again, we want people to have their autonomy. We want people to have their comfort level. If someone is having a particularly emotional time and needs to step outside to get some air, they are more than welcome to do that. One of the things people ask when they come to us is, because they've had previous interactions with the behavioral health system, are they going to take our shoelaces? Are they going to, um, am I going to have to, give over my stuff? Am I going to have to? The only thing we do have security at our, I want to emphasize, we do have security at our facility. They are plainclothes security people. Um, they're not armed. They are, the only thing they do is they wand a person when they come in. Individuals stuff, they're allowed to retain it. We will hold them. So the only thing that's a barrier for service is if someone has a firearm, they're not allowed to bring a firearm in. But even if someone has something like a pocket knife, a Swiss Army knife, or um something like that, we don't we don't confiscate that. We will hold that up for them up the front desk. We have a safe. We can hold that safely for them. And but we won't just dispose of that or anything like that. That is that person's property. We recognize, some people come from different difficult situations. They need those things. Some people are unhoused. That multi-tool might be a lifeline for them. We don't know what someone's situation is, and we don't want that to be a barrier for receiving services. So we can keep those things safely up at the front desk for them for their duration of their visit. But again, going back to the office, if you take a look at this space, again, using the living room model, we wanted to make our spaces feel as little institutional as possible. Again, going back with the open spaces, lots of light, soft surfaces. We want to put our consumers at ease when they're here visiting us. Comfort and client autonomy is really at the forefront of what we do. Valen, did you want to add anything? Oh, you're mute.
I'm totally muted. Yep, now I'm ready to move on to the next slide if you're good.
Okay.
So we're going to talk about this slide for a little bit, because as you see, there's a lot of content on here. And I'm going to spend some time talking about what our process is, what kind of things we support, and all the types of services we provide. As I mentioned, we provide wrap care. So the individual, when they come in, we do a triage to determine if they're in crisis, because as Daniel mentioned a couple different times, we are not a crisis response center. We are not equipped to handle crises. So if you believe someone's truly in a crisis, they really should go to a CRC, because that's the appropriate level of care for them. We can't do restraints, we can't lock them in, we have no capacity to that degree. Instead, what happens if we believe that they're getting flagged for crisis, we do a safety assessment to determine if they are in crisis or not. And what we are finding is that about 75% of the time, individuals are really struggling. They're not necessarily in crisis. So maybe they are having passive SI, maybe they are having back-to-back panic attacks and are having a hard time slowing them down, but not necessarily requiring an inpatient stay. And so those individuals were able to do stabilization on the, we can do interventions, we can provide support, we can actually do medications that day. We have medications on site, which I'll talk about in a minute. So we can do same-day dosing, things to help them get sort of more anchored back down in their stability. The other 25%, we do send them to the CRC. We have had a really great rate of being able to talk to people about going to the hospital on their own power, on their own volition, because we do think it's really important to be client-centered. We want people to feel like they have agency and choice while they're here. So to date, we've been open 5 months. This is actually our 6th month that will be open. In the 5 months that we've been open, we've only had to do 2 302s, and we're incredibly proud about that, because the individuals that come to us that we flag for true crisis, we are able to give them the support they need to feel comfortable and competent about going to the CRC. And sometimes that includes sending a peer specialist with them. So we do have a transportation service we use for that, HealthLink. For individuals so they can get to the hospital. We have linkage agreements with a number of CRCs, so that way we can do a fluid handover to them. And the peer specialist will go with people who are feeling unsure or nervous about going to the CRC, so that way they can go with them through the ride, they can go through basic intake procedures with them there, as far as the CRC will let them go with that consumer. And we've seen a positive outcome with that additional feature built into what we're doing. For those who aren't in crisis, who just need service supports, we provide crisis assessments, which is essentially a miniaturized CBE. We are doing a very truncated version of that because we're not here to do full intakes and full integration into our outpatient services. So even though we are part of Merakey, we are linked to many other agencies in the city to link services. We have a number of agreements with some providers who give us slots specifically so we can drop in outpatient appointments for individuals who urgently need them. So this is not a self-feeding facility. We don't feed back into Merakey, we feed back into the community. So we do provide a basic assessment for individuals to determine what their diagnosis is, what kind of level of care they might need. We do ASAMs for individuals who need substance use treatment to make sure that they're linked to appropriate care. We do PHQ-9s, GAD-7s, and TSQs to also do clarification for diagnostic purposes. We also offer peer specialist supports. As I had mentioned previously, our peer specialists have been amazing because they really help check in with individuals who are waiting in the lobby, check in with individuals who need support. They provide one-to-one care for those who need to go to a crisis center. We really love our CPSs here, and they are amazing, and we just want more of them. We could, because they're just that fantastic. We provide a basic nursing assessment. We do UDS screenings here for different substances. We also do pregnancy screenings, so that way we can prescribe safely to individuals. We can also do blood draws, which is fantastic because that way medications that require more in-depth laboratory evaluation, to some degree, we're able to do that to get people started or restarted on medications. And then we have our psychiatrists. We have CRMPs who are able to do, once again, miniaturized psych assessments. So I think that's a key piece here, is to know that we're not doing full evaluations here. Because we're in urgent care, the idea is to move them as quickly as possible to get them what they need. So our assessments are incredibly targeted for specific information, so that way we can get the most specific information that we need to make a determination for recommendations for care, and that we can give medications. Many people come to us for bridge scripts. Maybe they missed an appointment with a doctor. Maybe they were switching doctors and didn't realize they didn't have enough to get to the next appointment with a doctor, and they'll come to us for bridge scripts. For those individuals, we do ask that they bring the most recent bottle prescribed to them, because for us to provide bridge scripts and do an expedited level of care, we need to be able to confirm that they are indeed on this medication currently. We're also able to start medications. So if they want to start medications, they go for a little bit longer process, because we have to do more well-rounded evaluations for them to be able to provide them with the care that they need. While here, they can get same-day therapy if they're feeling like they just need to talk to someone. We have individuals, especially with the plane crash recently in the Northeast, we've had individuals come and say, I don't know what to do with this information. I just need to talk to someone. They can come in. We do brief solution-focused therapy, I apologize, sessions with individuals. They usually range 30 to 60 minutes, depending on what the individual needs. We also have CPSs who can provide care and wrap plans if they need a lower level of interfacing, or if they are less trusting of formalized therapeutic professionals. We also have CPS for that reason. And then each individual also meets with our case manager to make sure that they're getting successfully linked to whatever services they need. We do SDOH assessments when they arrive, so that way we're also addressing those pieces of care, making sure that they get linked to food or housing resources, items like that. We want to make sure that the individual is getting everything they need to be successful when they go back out into the community. One of the great things we also have here is something called our care closet. For those who maybe have soiled clothing or are maybe lacking in some toiletries, we're able to give them those things. We had an individual here who needed to go to the hospital, who needed to go to a CRC, and one of the barriers they were experiencing was that they wanted to go home and make sure they had their pajamas with them. And we were able to give them some sweat clothes and things like that, socks and underwear, and so they would feel more comfortable going to the crisis center and have things that were theirs. So we find this a really important component of what we do here, because respecting their dignity, autonomy here is very important. As Daniel mentioned, they can come and go as they please. No one's locked into these units. We have people who go for walks. If there seems to be a longer than average wait in the lobby, they'll go get some food, bring it back and eat it in the lobby, or reheat it in the microwave out front. They have the ability to get the things they need and not feel hemmed in or pinned in because of it. They can use the bathroom, those sorts of things. And we see that people have really positive outcomes for that. With our current consumer survey, right now we're at a 97% success rate, that people rate us as either great or good, their experiences with us. And the most common feedback we get is that we were really just hearing what their concerns were. We weren't making determinations for them what they should have. Instead, we listen to what is it you want? Why are you here? And let's get you that thing that you're looking for.
Mhm.
As we talk and we realize you might not know these other options are available to you, we'll also offer them to you. But at the end of the day, it's choice. You choose where you want to go, what you want to do, which is also why it's so important that we have linkages with other community organizations, because they might want to go to a particular provider, or maybe they don't because they had a certain experience with them, or we want to find things that are closer to their homes. So the services we provide are many. We can address many different things. And individuals coming to us most often are looking for bridge scripts, but the other thing that we're seeing is that we are filling a gap for people who need to access mid-level care or who need to access evals for very specific reasons. So it's common for instance housing, you need to do a psych eval for that, but maybe they don't need psychiatric care, maybe they're sufficiently, stabilized in a lower level of care or outpatient level of care, but they have to wait months for a psych eval. Now they can come here and just get a quick eval. What I do want to make sure though that I mention is that we don't do any like disability, we can't sign off on any disability form saying that we're saying yes or no that they have a disability. We don't provide ongoing care, so we can't track them at length to determine if there is indeed a diminished function for their daily life. The other thing I want to mention, as I said, we do have medications on site, but we do not do any MAT and we don't do any controlled substances. So that includes having them on site or prescribing them. That was very intentionally done because we wanted to reduce individuals coming here who were substance seeking specifically. We are really focused on those mental health medications and prescribing those items. I know you guys are going to have a lot of questions about this slide. So I'm going to get through the last couple slides and then I'm going to bring this back up on the screen when we do the Q&A, so that way we can talk further about it. So we really, really want to reiterate that we are not a crisis center. It's very, very important that you know that. Not only does that sort of pull resources from us to try to care for this individual, coordinate them getting to the hospital and whatnot, meaning that other people who are there, it lengthens their time because we need the staff to care for this individual. It also creates this experience of the mental health system that they keep getting shuffled around, right? So if they came to a clinic and the clinic said, oh, you need to go to the urgent care because you're in crisis, and then they come to the urgent care and we go, oh, you're in crisis, you're not supposed to be here, and then they get sent to the CRC, right? They're now having this experience of being passed along. We want people to feel like they're getting what they need when they come to us. And one of the things that we just cannot provide is crisis care. So I just really want to highlight, if you believe somebody is truly in a crisis, please send them to the CRC, because we're just going to send them there anyway, and it's going to frustrate them further and possibly undermine their faith and belief that the system can help them. So we've been open since September 2024, September 3rd to be specific. This is actually our ribbon cutting here, and we've actually been very popular since day one. It's been nonstop. We've seen over 1,000 individuals at this point in 5 months, and we're incredibly proud about that. We're currently looking at how to keep moving forward our different pathways and expedite processes, because we are a pilot program. This has not existed in Philadelphia before. Other urgent care type facilities in and around the country are highly variable based on the communities that they're within and the system that they're within. So we're taking this first pilot year, to try to refine as much as possible that people aren't waiting as long and get through the process faster. And then this is just our contact information. I'm going to be sending these slides to Liz, so that way she can send it out as well. But feel free absolutely to contact me if you have questions about our services, if you have concerns, if you have referrals or linkages you want to make. because we really do want to continue to build that community connection and linkages with everyone. Daniel Orsino, specifically our community liaison here co-presenting with me, is responsible to bring brochures if we need them. If you need to do us to do a presentation like this, help coordinate it, those sorts of things. So please reach out to us if you have any interest in those things. So with that, I'll go back to the previous slide I mentioned, and then I will hand it over for questions.
Yeah, thank you so much. And Liz will take care of facilitate the Q&A. But thank you so much for that presentation. We have almost 60 people, and there were questions throughout the presentation, which means this is information that we really needed. So thank you for taking the time and being here.
Absolutely.
Yes, thank you so much. We have got some questions throughout your presentation, and I know that you mentioned this at the very beginning, but I think for people who didn't get to hear it, what kind of insurance do you accept other than Medicaid? And can you talk about the insurance piece of what the Merakey Mental Health Urgent Care does?
Sure, I'll let Daniel talk about that one.
So right now we're insurance neutral, which means we take any insurance and any Medicaid, but we're not currently billing. So we can take Medicaid from anywhere in the country, not just Pennsylvania, not just Philadelphia County, but we're not billing insurance currently right now because we're fully funded by the city until at least July. The only reason we ask for the insurance is to know what sort of linkage to provide the consumer. What sort of agency or nonprofit or maybe health network that we're going to link the person. So say they want outpatient after they visit us. We need to know what kind of outpatient is going to take their insurance, and we'll provide them a linkage accordingly.
Yeah, and I think one other thing that's really important to know is we're hoping to hold on to that model. You know, obviously we're still talking to the city of Philadelphia and working out what we can and cannot do come July 1st. But we're seeing people, we have had people from Texas and California, we've had people from Bangladesh, people who are just passing through because maybe they're visiting family and realize they're out of medications, or maybe they just moved to the area and they're out of medications or need supports. We've had people who are undocumented who need supports. So this model is incredibly beneficial to those individuals who fall between the cracks in the system. So that way we can help catch them. I also want to highlight that we do use a language line here for individuals who speak languages other than English, but we also have some Spanish speaking staff, including a therapist in our case management, so that those individuals can also be serviced effectively.
Thank you. And that answered another question about language access that someone had. I think, Fallon, you mentioned CBE assessment at one point. Can you explain what that acronym is?
Oh, a comprehensive biopsychosocial. So it's very common at most outpatient clinics, and usually because it's bound by NIAC for them to hold to that, they have to ask a pretty intensive level of questioning, ranging from like development, what kind of education and all that business. We don't need to know all that for us to do therapy with you real quick, or just to get you started on medications. We are not looking to have your full on history. We really just want to know in the last month or last 6 months what's going on, not for your full duration of mental health services. If you think something's relevant when you talk to us, please obviously mention it. But we are trying to get you quickly into the next level of care based on your most recent or current concerns. So CBE is done for people to get a full assessment of their full development and levels of care as they have aged within the system.
Thank you. Someone wrote, "This is an amazing program. Thank you so much. Are youth able to be seen here, or are services for adults only?"
For adults only currently. There is an urgent care for children located at Path's main clinic at 1919 Cotman Avenue. So that has existed for several years now, but we are the first for adults. I do want to mention though, if they bring kids with them, not for us to treat, but we know that that also tends to be a barrier for care, is people who have children and maybe struggle to find childcare and things like that. they are able to bring them in here. We have coloring books, we have blocks, we have things for them to play with, we have snacks. But we don't want that to be a barrier either. So individuals are allowed to bring family members or their children in with them.
That's a great point to just make sure that people know about when they're referring people. And great that kids are welcome to go along with their parent as they're getting services. Another question about, do you provide services to all people regardless of their immigration status? Yes.
Let Danielle take care of that one too.
Yes. So yes, we do see people regardless of their immigration status, regardless of their documentation. We have contacts with some of the consulates here in town too, so we can connect someone to their consulate if they need to be connected with that. We have resources with different organizations that specialize with helping different immigrant populations. So we work very closely with individuals who may be from certain immigrant populations and that may have different statuses.
And one of the things I'm really proud about Merakey is that we actually have an ICE policy. So if ICE does arrive, our staff know what to do, what they are allowed to do, and what they're not allowed to do, to make sure that our consumers feel as safe as possible while they're in our clinics.
Yes. Oh, thank you so much for sharing that. I know that that's very important to make sure that people know what to expect and that they can feel safe. Another question asks, is there gender affirming care available here?
But Danielle?
We have connections to, we don't have gender affirming care on site. We are an LGBTQ affirming space, but we have connections to agencies that do provide gender affirming care.
Great. A couple people have asked, what kind of wait time should clients expect when they're going to the mental health urgent care? And should they call ahead or schedule any kind of alert for coming to the center or just show up?
That's a lot of information. Okay. All right. If I miss any piece of it, just let me know. So the first thing is that we're walk-ins only. We don't do appointments. We will prioritize if you are particularly as an agency sending someone over, please call and we will put them in the queue so that way they're seen as soon as they arrive. Because we do for making sure connections stay effective in the community, we really want to make sure they get expedited. So when people come, they are triaged, as I had mentioned, based on safety and what they need. We have to prioritize people who we consider a safety risk, first and foremost. We also prioritize individuals who specifically need medications because sometimes we have an influx of people who are looking for psych evals and they take the longest. And it turns into people who truly need medications, like they need medications that day, are now waiting and possibly not going to be seen because we have too many psych evals for the day. So we do some shuffling and reorganization as people come in to make sure higher priority people get seen. But otherwise it's essentially first come, first serve. One of the things that we are trying to figure out how to improve is that we have 5 exam rooms. So there have been days where 15 people arrive as soon as we open the door. It takes about 2 hours to turn over each individual, depending on how much of the process they're going through. So the full process takes about 2 hours. So if we have 15 people, only 5 can go back. So the 10 people are sitting for at least 2 hours, and then we can take the next 5 back, and then the next 5 are sitting for 4 hours, and then still have to be seen for 2 hours. So it can be highly variable depending on what time of day they get there, how many people are already there, if we're having any high priority crisis situations at the time. So we are working on finding additional pathways to shorten stays so that doesn't happen. We're also looking into currently developing a text-based system so people can come in. We can say, hey, it looks like it's about a 2-hour wait. We can text you a half an hour before your available time is, so that way they can go back out into the community and then come back when they need care. So we are looking at ways to improve that right now, but typically a person, when we're having a good flow day or they're one of the first people here, usually it takes about 2 to 3 hours, including wait time.
That's very helpful information. And I think the point about that you have the kitchen that patients can use, and that they're kind of free to get up and move around, go outside, take a break, is helpful context if you're preparing someone to go visit the mental health urgent care.
We also have a TV in the waiting room. It's usually playing Family Feud.
They love
Also
Family Feud.
help. And you had mentioned that if an agency or organization is sending someone over as a referral, what is the best way for that referral to happen? Do they just pick up the phone and call Merakey, or is there an online form that they should be submitting when making a referral?
We ask for a direct call and to speak to the supervisor here. So we do have a caregiver coordination supervisor who's responsible for the case managing referrals, making sure info and loops are connected or finalized. We prefer to talk to the organization for a couple of reasons. First, it's just good so we know who to contact back with the information if they need an update on care. Secondly, it is helpful because usually the organization can be very specific about this is why this person is coming. We've had people who have been dropped off by organizations and say, I don't know why I'm here. You figure it out, you know. And we haven't been able to get a hold of somebody to say like, hey, like, what did you need for this individual? So we really want to improve those levels of care that way. And then finally, the third reason is because we want to make sure we have some good core information about the person, because that also expedites things, right? Our assessments are targeted at very specific information. So if you already know that information and can give it to us, it shortens the amount of time that individual has to be there because we can pre-upload that into the system. So there really are a lot of benefits to calling ahead to really help organize and support that individual moving through the process quicker.
Great, that is very helpful information. I'm sure, I think most of the people on this call are providers of some kind, so this will be very helpful. A couple questions about medications. Someone asked, what if someone doesn't have an old bottle? Would a blood test determine what they were on, or do you start from the beginning?
We will call the pharmacy. We call the pharmacy or the previous provider to see. So the catch there, though, is if the pharmacy says, oh no, we don't have any, that they've been on this medication for over 30 days with no refills, or the prescriber says, no, that's not something we prescribe, then we will consider that restarting or starting medications instead of a bridge script.
And then are providers trained and comfortable with prescribing bridge medications to pregnant individuals? The person who asked the question said, I've encountered providers who won't prescribe to pregnant folks, even though many medications are safe to take when pregnant.
It depends on the circumstance. We had a mother come in, for instance, who had 3 children. She was also pregnant, but she also had a use of cocaine. And there was a concern about sort of that combination of things. So we do refer individuals over to Temple. They have a program specifically for pregnant individuals who are on substances. We are also in conversations with Courage Medicine, who also provides supports around things like that. We are comfortable prescribing to pregnant individuals within a certain scope. So that's up to the psychiatrist to make those determinations, but we have prescribed to pregnant individuals before.
If the person needing the support has a peer support person or advocate, can they accompany the person and provide support during their assessments and care?
100%. So as long as the consumer is indicating they feel safe and comfortable with that person coming back, and that person also is not becoming disruptive to the rest of the unit, they can bring people back. We do try to limit how many people we have found through trial and error, because one person brought like their whole family. They literally had 12 people with them, which is great. We are so excited they had that level of support system, but it became challenging to A, fit them into our exam rooms, but B, they were also causing other disruptions with the other clientele, because they were going out and coming in and going out and coming in and then chatting with people, and then it caused some complications. So we do try to keep it to like 2 or 3 people with them max, but they absolutely are welcome to bring support people with them.
What are some non-medication reasons why someone would come to the clinic?
Oh, there's lots of those.
Yeah. Oh yeah.
Many of those. So we have people come, like I mentioned, for psych evals, for other levels of care, for psych evals, for housing. We have people who come for therapy or to get a RAP plan. We have people who need case management. I can't tell you how many times people have come and say, I'm new to the mental health system. I don't know what to do. I don't know how to navigate this. And so we can really sit down with them and help them figure out what kind of services they need and what to get linked to. We have people who come back just for the snacks, especially transient individuals. There's a number of reasons people come through, and it's not just for medications. Medications makes up a little bit more than half of the people coming through. But we actually have a very large amount of people who are just looking for support, and they don't know what to do and how to access it.
We have people come back just because they're having a bad day and they just want to talk to somebody. So to add to that, what Valen's saying, I mean, sometimes people just come back just to literally speak to someone because that's all they need. Not even ongoing services. They just need to talk to somebody in that moment.
I do want to highlight something that I didn't mention about medications. We do have agreements with local pharmacies to get medications at cost for people who maybe are in between insurance providers or undocumented or transient and are unable to successfully get medications independently. We do work to get them on insurance because we can't provide that support ongoing, but we are able to pick up medications and pay for them in some specific circumstances.
Got it. Also very helpful to know, and what a great partnership to have to make services accessible. The last question I see in here, unless anyone submits any other questions in the next couple minutes, is do you provide childcare?
We do not. We don't unfortunately have, so our clinic's fairly small. And we have limited capacity. All our staff are very busy during the day. So if they are bringing children with them, we expect the children to remain in the exam room with the guardian or whoever has come with them, and be able to provide care and oversight. There's no reason for them to be anywhere else in the facility without their children, except for maybe the bathroom, which we would sit with the kids for a few minutes so they could go to the bathroom, yes, but we won't provide childcare otherwise.
Another question just came in. Are there any internship opportunities for graduate students?
We're building that out right now. That's a great question. We're not quite yet ready for interns. We're hoping to do it this come the summer, but we're in the process of actually sort of building out what that would look like here, since it's not a traditional location for those things. But feel free to call.
Yeah, it sounds like I think this has been a very helpful webinar to introduce people to all of the great work that you're doing, and the kind of overview of all of the services that the Merakey Mental Health Urgent Care can do. And it sounds like you are both really available and interested in connecting with people more about what kinds of partnerships can exist moving forward. So I will definitely be sharing the PowerPoint slides after this webinar and your contact information so that people can get in touch if they would like to. But this has been so great and very helpful to get the word out about this great service.
Thank you so much for having us. We're excited about this. And I hope that this is helpful for everybody. Feel free to reach out to Daniel or I for anything, and we'd love to talk to you.
Thank you so much.
Thank you.
Thank you, everyone. Bye.